Hi, dear friend. The fact that you're looking at this presentation to define the research question definitely tells me you're a researcher at heart. For dear researchers, this is the most important part of what you're going to do, defining the research question. This defines everything else after that. We're looking at a question which looks at all our data and converts it into evidence. So, what we're looking to do in clinical research is format evidence of all the random data we have. When you look up at the sky at night, you look at so much data. There is data points and data points, stars and stars. But to convert it into a kind of a constellation, the Ursa Major or the Great Bear, what's the question people might have asked? People might have asked, are these, I want to see stars which are in a particular shape or can be made into a story. They can be talked about as a polar bear. Or perhaps I want to see stars which, whenever the seasons change, these stars don't change in relation to each other. I also want to see stars which are pointing me in a particular direction when I'm on a ship. So there must have been some questions. Without that question, they cannot convert this information into this result. So whenever you're starting or talking about your research question, and I know many of you would be doing a thesis, this is the most important and the most critical step you have to do. So the only difference in looking at random data and then maybe, उसमें हम correlation निकालेंगे, to converting it into research is the question. What am I looking for? Now, many people, youngsters, will come to me and they will say, I'm looking for, Dr. Pooja, I want to see predictive value of all my parameters. I want to see outcomes of my patients. I want to find out the risks. I want to see correlations. I want to see incidence of events. I want to see causality. Does this risk factor cause that particular event? I want to see odds. I want to see prevalence. They will throw all these words at me, right? The only real, have you, any of you ever tried to do this as well? So when when you're sitting for a research thesis discussion with your guide, and many a times guides do this also, please. So looking at everything, I want to see prediction, I want to see risks, I want to see odds, I want to see correlation, without really understanding the science behind each of those terms. And the best is all of us want to do it in a small sample size of 30 people only, because minimal sample size requirement for a statistical test is 30, and I want to do my thesis in the minimal number. So let's do it in a sample of 30. So to these people, I ask this one question. What is your research question? With limited understanding, most days, this interaction results in a first and last experience. Many a times, these researchers will not come back. Many times researchers catch me on the dining table in the cafeteria and they'll say, Dr. Pooja, I've seen some really fantastic results in my stroke patients, or I've seen really fantastic results in my patients with laparotomy, laparoscopy, with hysteroscopy, this, that, everything. And when you say, okay, fantastic, can you identify if we, and I want to publish this. So when you ask them, what is the research question you want to publish on? That is the time when they have no answer. So when you're just doing these random descriptive studies, these are not really adding anything to a research knowledge. Even for a descriptive study, you need to have a research question. Now, what are the research parameters that define a good research question? I'm sure all of you, when you've gone through your training in college, have been taught this. So the question needs to be feasible, it needs to be interesting, it needs to be novel, ethical, and relevant. And we call this the finer criteria. Now, I am a gynecologist by training, so I would love to talk about something called the cervical cancer vaccination, which is currently the conversation in every room. Is this vaccine any good? Right? So many mothers will come and ask me this question. My yoga partners will ask me this question. My mother will ask me this question. Everybody asks this question. Is this vaccine any good? Now, this is a very simple, non-specific, generic question, but for a researcher, this is not the question. Also, it's not a cervical cancer vaccine. It's an HPV vaccine. So let's look at the questions that researchers can think. Now, researchers could think of questions like, Is this vaccine efficacious? Is this vaccine effective? And I've specifically used these two words for you because I want you to understand that there is a difference between the two. In English, it might seem that they are both very similar terms and similar words, but in research, they are very, very different words. Efficacious vaccines are when you're looking at efficacy of the vaccine, the efficacy is identified in a clinical trial setting. So usually a phase 3 clinical trial is called an efficacy trial. It's in a very restricted environment. There are strict inclusion exclusion criteria, strict outcome indicators, points where assessments are done. That's an efficacy trial. Effectiveness trial, or the question of is the vaccine effective, are real world studies, right? Where many people like me who might have taken just 2 COVID vaccines instead of 3. There are people who've taken several boosters, people who've mixed vaccines. This is effectiveness situation. In real world situation may not be the same as in a clinical trial. The third question of interest could be, is the vaccine safe? Which is something which interests most of us, and it's a very simple criteria. But again, a researcher likes to think, when you say safe, what do you mean? Are you talking about adverse events? Are you talking about serious adverse events? Are you talking about adverse drug reactions and serious adverse drug reactions? Now, these are two different terms again, adverse events and adverse drug reactions. Adverse events are untoward medical events which may or may not be related to the particular investigational product, here the cervical cancer or HPV vaccine. And adverse drug reactions have a definite correlation, which is either temporal, and they have a causative correlation with the investigational product, in this case, the vaccine. The next question that a person can talk about is, can this vaccine protect from COVID? Now, this could be an interesting science behind it. Let's look at the science behind it. If it makes sense, let's look at cross protection that a vaccine might give. This might be an interesting question to answer. So when you're looking at one parameter, there are still so many questions that can be of interest to investigators. Now I'm looking at, can vaccine protect men from penile cancer? Now HPV is known to cause penile cancer as much as it's known to cause cervical cancer. Can this vaccine protect from that as well? That's an interesting question. Same thing for oral cancer. HPV is known to causing oral cancer. Can this vaccine protect from oral cancer? Can this vaccine cause death? Right? That may be a question of interest. And several such questions could be there. Now, all these questions you must assess on a finer criteria. That means, is it feasible? Is it interesting, novel, ethical, and relevant? Now, many questions could be relevant, but may not be, morally relevant, may be ethically difficult to do. Some may be practically impossible because you'll have to look at the outcomes for several years. You will have, suppose you want to see, does it really protect from cervical cancer? You will give it at 13 years of age and wait till 45 years of age to see if the person gets cervical cancer. This kind of a thing may not be practically feasible. So everything you do in a research question must be assessed on these: feasible, interesting, novel, ethical, and relevant. Now, the next term that I want to introduce to you is called PICOT. So when you're looking and you roughly decided, okay, I want to look at, can the vaccine protect from oral cancer? This is the question of interest. You need to define the question of interest a little clearer. And that is the parameter called PICOT. Now we've heard the term finer, and the other term you might have heard earlier is PICOT. This defines your inclusion and exclusion criteria, helping you define the research question in a little more detail. This includes P for population, I for intervention, C for comparator, and if you have put any comparators, and O for outcomes, and T for time duration. So let's go back to our question. If we are looking at the question of, is the vaccine efficacious? Is the vaccine effective? In each one, let's look at the parameter whether if the vaccine is effective. Now we are looking at effectiveness of the vaccine. That means it's a real world situation. We need to define population. That means what age of people, which gender. If suppose you are checking this HPV vaccine for prevention of oral cancer, you may give to both genders. If you're looking at penile cancer, you may give to the male gender. If you're looking at cervical cancer, you may want to look at only female gender. You may want to define which age group you're looking at. Are you looking at rural patients or urban patients? Are there any other inclusion and exclusion criteria that make a difference to you? That is your population of interest. I is your intervention. Which vaccine are you going to use? What is the dose of the vaccine you're going to use? What's the dosage? Are you going to give multiple doses? Are you going to give two doses, two injections, three injections? Be very clear. Are you giving it at a monthly interval? Are you giving? So your question is now getting defined. Your protocol is actually getting defined by just these two parameters of finer and PICOT. C is comparison. Do you want to have a comparator or not? Is it ethical to have a comparator or not? Is it possible that we can give some people the HPV vaccine and some people not? Possibly yes. But was it possible with the COVID vaccine? Possibly not. You have to give everybody finally a vaccine. You cannot have people who are in the control arm not get a vaccine. Outcomes. Outcomes is the toughest thing to decide. How are you going to measure? These are the measurables. How are you going to measure your answer? How are you going to measure your results? How are you going to make out whether the question you've asked is answered by your study or not? Now, outcomes is something that we can possibly look at in a totally different presentation. Now, time is another parameter. So, can you really do this? And especially for people who are actually attempting a thesis, please look at this parameter very carefully. If your sample size with your research question and your statistician's help comes out to a number which you don't think you can ever get in your 2 years thesis, don't try this question. It's not feasible. So the first parameter, which is finer, needs to be met, right? So let's be very careful in assessing the finer and the PICOT. Once you've done these two on a piece of paper, there is no one stopping your thesis to go ahead. After this, the only question you really need to answer is what's your research methodology and what will get the answer to you in the least budget in the quickest time. Now, this is a presentation for another time. Thank you so much.